Good morning, Keith Tebow from FRCMedia. Thank you for joining us. I thought we'd take a little time today to talk a little bit and get an update on the distribution of the COVID-19 vaccine here in Fall River. You know, we've talked a lot about the urgency of people getting vaccinated, and now we're sort of in a lull, although the focus has switched a little bit to those younger in our population, those 12 to 15 who are able to get the vaccine. I'm pleased to be joined by someone who we've spoken to quite a bit before, Dr. Eric Vaught. Dr. Vaught is the medical director at the HealthFirst Family Care Center. Dr. Vaught, how are you? Thank you for joining me.
Be back on today.
I'm sorry, I just had you muted. Thank you for joining me. I appreciate it. I want to let's talk a little bit about just general vaccine distribution. You know, when we spoke last earlier this year, you know, there was a push to get seniors vaccinated, and, you know, having the ability to distribute the vaccine was very important. Now, you can get the vaccine in a number of locations. It looks like that there's been sort of an ebb, if you will, in terms of a downturn in terms of the number of people getting vaccinated. Is that what you're seeing still at Health First, because people who wanted the vaccine have pretty much gotten it?
Yeah, that's exactly what we're seeing. So across the state of Massachusetts, it's very promising. Over 50% of Massachusetts residents have received the COVID vaccine. But unfortunately, here in southeastern Massachusetts, we have not had as high a uptick of people getting vaccinated. And so both here in the Fall River community and in the surrounding communities, there's been a real push to educate and advocate for patients to continue to get vaccinated. And now that we've seen the expansion of vaccine to those that are 12 to 17 years old, is really getting the word out and really advocating that people sign up for an appointment. There's lots of appointments to be had. People can go to FRVax.com, which is what the city has set up as a central location that highlights all of the places across the city of Fall River that folks can get vaccinated at.
Yeah. You know, I know that, now that the 12 to 15-year-olds can get vaccinated, are you seeing many of them coming into your center? Or is it still something where either, parents may be concerned, or maybe, even some of the youth may be concerned about feeling that, I'm young, I'm invincible, I really don't need the vaccine?
Yeah, so we have patients that come into the health center. We've been talking about the vaccine, and we were waiting for the FDA approval for the Pfizer vaccine, and we're expectant that the Moderna vaccine will get approval later in June. We currently do not have the Pfizer vaccine here at the health center, and so we've been advocating that our patients make an appointment through South Coast, who does have the Pfizer vaccine, and able to give the vaccine to those that are 12 to 17 years old. And so it's a discussion that we get to have with the patient and their parent, and really an individualized risk benefit of getting the vaccine in this population group.
Yeah, I know that, in the past week, a lot has been made in terms of potential heart effects for some of these youngsters. Myocarditis has been diagnosed in, again, a very small number of youngsters who have received the vaccine. What can you tell us about that in terms of, is there really a risk that people need to be concerned about in that age group?
Yeah, that's a great question. We have not here at the health center had a case of myocarditis, but there has been reports in the lay press and also in some of the medical literature about a risk of myocarditis, swelling around the heart after getting the vaccine. And more information is needed in the coming weeks as we kind of unpack this a little bit more. What we do know is that those individuals who get the COVID virus and are infected also run the risk of myocarditis. And what we know, at least preliminarily, is that those that are infected have a higher rate or higher likelihood of getting myocarditis than those that are vaccinated. So the current guidance is still to get vaccinated to prevent the teenager from getting the virus itself.
Yeah, and obviously there's more testing going on in terms of distributing the vaccine to those even younger than 12. We haven't really heard too much about this at this point, but do you expect that we may hear something as we get closer toward the summer, that maybe even youths that are younger than 12 will be able to get some version of the vaccine?
Yeah, so the studies currently are ongoing for those ages 2 and up, for the Pfizer vaccine and the Moderna vaccine. And I suspect, based off of the timeline that we've seen so far with adults and then with this adolescent population, that it would be in the mid to late fall that we would see the data coming out, maybe even as early as the end of 2021, that would say, yes, we can proceed with vaccinating all individuals aged 2 and up.
Yeah. And I know another thing that is still on many people's minds for those of us who have been vaccinated is, the likelihood of some sort of booster. That data is still being collected, from those of us who have been vaccinated. How long will this vaccine rather still be effective in our bodies? And although a lot of the, Pfizer and Moderna have been reporting that there is all likelihood that we will need a booster. It's just a question of when. And I guess that's the big question for a lot of people, right? In terms of that unknown.
Exactly. And for those of us in the health field, we were one of the first to get vaccinated as they were rolling out the vaccine. And so I got my vaccine back in December and January. And so as we start into the month of June, I'm 6 months removed from my second dose. And so the question becomes, how far out before you need that booster shot or that additional vaccine? And so the question remains. I suspect we'll have something as far as guidance around September of this year, as we move into what is typically the flu season of next fall and winter.
Yeah. Very interesting to see how all this develops and how it's developed so quickly. I actually want to go back, if I could, to those in our region who have not been vaccinated. As you mentioned earlier, Bristol County is below the rest of the state in terms of the percentage of its population that has been vaccinated, either with one dose or fully vaccinated. At Health First, as a community health center, you tend to see a lot of people in those underserved communities come to you for guidance. Is there still a big push amongst your population, the people that you see there at Health First, to remind them of, whether they've been vaccinated or not, and to get that vaccination? Because, a community health center tends to see people who may be reluctant to be vaccinated more than, say, just a local primary care physician.
Absolutely. Um, uh, the rollout of the vaccine, I think, has been a very interesting to observe from a human behavior standpoint. When we started this process, and you and I talked, Keith, we were doing the best we could to get as many vaccines as we could and open up as many appointments as we possibly could to meet that initial surge of demand. And that was a very passive process. We had to just get the vaccine, we had to open up the appointments, and then people that wanted the vaccine found their way into our clinic or into one of the vaccination sites across the state of Massachusetts. Now we're into the second stage where we have to be much more active and advocating on behalf of our patients. And so we're making those phone calls out to our patients and doing the outreach. We're going to these family members and saying, that are in those communities, and saying, be an advocate on our behalf that you successfully got the vaccine. Now tell your family members and invite them to come to the health center and get vaccinated. And really going from a very passive process to a very active and engaged process here in the last couple of weeks.
Yeah, definitely something that has been fascinating in terms of, I remember when we spoke, it was more about the supply, right? We didn't have enough vaccines. People wanted the vaccine. And now it's the opposite. We have plenty of vaccine, and now we need the people to come forward. So I appreciate the update, Dr. Eric Vaught from HealthFirst Family Care Center. Thank you for your time as always. We'll catch up again soon. Thank you. All right. And thank you for joining us here in FRC Media. I'm Keith Tebow. Have a great day.